Good afternoon and welcome back. I'm Marcus Peter. Some time ago, a British appeals court ruled against a hospital that withdrew life-sustaining treatment from a patient without family approval. We're joined by my good friend, Dr. Andrew Kubick, to talk about this. Andrew wears many hats. He is Senior Research Fellow for Public Policy at the Catholic Healthcare Leadership Alliance and Ethics Consultant at the National Catholic Bioethics Center. Andrew, great to speak with you again, my friend. How are you?
I'm doing well, thanks. It's great to be with you again as well.
For the sake of our listeners, let's go through the story and then we can talk about some of the Catholic insight into this.
Absolutely, and you did a great job in the lead-up as well. So last year in April 2025, a 68-year-old gentleman named Robert Barner suffered a stroke, as well as subsequent strokes after that. He was clinically diagnosed with, and this is really a quote here, extensive and irreversible brain damage. However, despite that diagnosis, he did continue to show signs of responsiveness. So I'll just say for your listeners, this was not a case of whether or not he was what they call brain dead. He was very much alive, and there was not a question about that. But some of those signs of responsiveness included following people with his eyes. So when people were in the room, he would follow them with his eyes. He would blink on demand and even squeeze people's hands when he was holding it. However, it was during that time that he also suffered something called acute kidney injury. And acute kidney injury in his case required dialysis, what they call renal dialysis, twice a week. And it was that intervention, it was that medical intervention, the dialysis, that in late 2025, a group of clinicians, 3 of them in fact, determined that it was clinically inappropriate, that was their words, to continue that dialysis. The family, of course, appealed, and it was during that appeal that the hospital on February 11th withdrew the dialysis, and shortly thereafter he passed away. And as you noted in the lead-up, the hospital was found to be at fault for discontinuing dialysis while the courts were considering the appeal from the family.
The hospital withdrew treatment and withheld treatment as if they did it unilaterally, and they cited a clinical decision, or the decision was made on clinical grounds. Can you please speak to that?
Sure, certainly. So what they were doing, and we find this in the United Kingdom's National Health Service, that when there is a patient who is considered incompetent or lacking the mental capacity to make one's own decisions, they defer to the family until the family is in disagreement with the clinical diagnoses and prognoses of the healthcare team. And that's what happened here. And so the clinical decision was in fact saying that it would be inappropriate to continue that dialysis. In fact, it would be inappropriate to continue that life-sustaining treatments, because that's exactly what it is.
What does British law say about the kind of care that is mandated, especially in the case of a mentally incapacitated adult?
Sure. Well, it does fall down to the discretion of the clinicians, of the healthcare team to determine. I mean, I'll use some Catholic bioethical terms here to really determine what is obligatory or what we call morally ordinary. So they're making the determination. Now, that is to say that the clinicians, the healthcare team, have a vital role in helping the family make decisions for patients who have lost the capacity to make decisions on their own. But for the National Health Service, there is a tremendous amount of authority given to the hospitals, given to the healthcare team. And when there's a conflict between the patient's families, for those who are incompetent to make those decisions, and the healthcare team, the preference goes, the authority goes to the healthcare team until, and in this case, it's appealed, but even there, the appeal can fail.
How long from the projected judge's announcement to his passing, would he have survived had the judge announced it earlier?
That's a great question, Marcus. We don't know a tremendous amount about the case. But given the fact that he was on this dialysis long-term, And it seemed, and again, I'm only speculating here, but it seemed like he was doing well with it because there was no evidence to suggest they were withdrawing it because the intervention was futile. I would presume that he would have continued to live on this until evidence would say otherwise.
I couldn't agree more. And in fact, everything I've read about the case communicates exactly that. Could you also share with us, it wasn't just one doctor who made this decision unilaterally?
It wasn't, no, it was a group of 3 doctors. It was a group of 3 what they call clinicians who made this declaration, this clinically inappropriate designation or label for the continued renal dialysis, which again was life-sustaining for this gentleman.
And amongst the 3 and even other clinicians in the hospital, no one voiced objections or moral or conscientious objections?
Not that I've read. I haven't seen any reports that there were any objections within the hospital system, only by the family of Robert.
In a situation like this, then, from a Catholic perspective, especially here in the United States, if our listeners find themselves or find out about situations like this, what would be some proper moral courses of action to be taken immediately?
Sure. Well, that's a great question. Thank you for asking it. I think one of the most important things I can emphasize to your listeners is the fact that this dialysis, this renal dialysis, could have been determined to be extraordinary. Again, we don't know the intricacies of this case. It wasn't publicly reported. But there could have been evidence to support, and this is the key terms here, that there wasn't a reasonable hope of it benefiting him. And to be quite honest, Marcus, as you and I just admitted speculatively, it was benefiting him. But I think the question is, were there excessive burdens that couldn't be reasonably managed? We don't know to what extent he was experiencing burdens due to the dialysis. But Catholic moral teaching is very clear. If there's a reasonable hope of benefit and there are not excessive burdens, then we have a moral obligation to continue. If there is not a reasonable hope of benefit, or if there are excessive burdens, and I usually add can't be reasonably managed, then it falls to the moral discretion or becomes morally optional, the prudential judgment of the family. Now, with regard to if that were to happen here, fortunately in the United States still, now this is imperfect to say the least, but overwhelmingly the authority is granted to the family or specifically the healthcare proxy or agent. There's a lot of different names for the person who is designated to make decisions for the patient who cannot on his or her own. But that authority is overwhelmingly granted to that individual. And if, God forbid, a family would find themselves in that circumstance, then I would just highly recommend they have a very quick conversation. When I say quick, immediately with a patient advocate or with maybe if there's a social worker on the case, have it raised to the level of the bioethics committee. And you don't want to start with this, but if it becomes absolutely necessary, to seek out the local jurisdiction, the local judge or magistrate to see if there could be a temporary injunction put in place to prevent the hospital from acting against the wishes of the family until this can be further pressed out. But I want to kind of close with an emphasis decision, and I'm going to read real quick for you and your listeners. ERD, Ethical and Religious Directive 56 from the U.S. Conference of Bishops, tells us that the determination about whether there's a proportionate benefit or excessive burdens falls to the patient or the patient's surrogate and should be informed by professional medical advice. So it's the patient or the patient's surrogate that is the decision maker.
I really thank you for all of that. Gosh, we're out of time. Every time I speak with you, the time just flies. Andrew, thank you very much for your insights. We're going to include ways to contact you and your work in the description. Thank you for your time.
Thank you for having me on again, Marcus.
My guest has been Dr. Andrew Kubick. He, like I mentioned, wears many hats. Right now, he's Senior Research Fellow for Public Policy at the Catholic Healthcare Leadership Alliance and Ethics Consultant at the National Catholic Bioethics Center. We've been talking about the unfortunate story of a man who was taken off medical care in the UK. Stay tuned, I'm Marcus Peter.